All right, Dr. Emer, we're live.
Hey guys, it's Dr. Emer. Now we did the first deep microneedling treatment for our acne scar patient. We're now working on the CO2 resurfacing. I'm gonna show you guys really quickly. She just did an upper eyelid surgery. We're in the OR. She had her upper bleph done. We do that in our office. And we have on here now our innovative optic goggles protecting her eye because we're going live for her CO2 laser. You could see the CO2 is more aggressive. This is our ablative laser, and it works to, Rose, we're gonna have to move this here. It works to resurface the skin. So you guys could see all those little dots here are gonna be char. They're gonna be scabs that form because we are gonna peel this area so that her skin is much smoother, healthier, and fresh. There's a lot of risks with CO2, including prolonged redness, hyperpigmentation, poor healing, but all of that will improve over time and with the right skincare. So a lot of times I tell my patients 2 to 3 weeks, even up to a month after laser, it's really important, especially ablative laser, to do a peel. We even pre-treated with a peel here from emeragecosmetics.com.
It's on our page, guys. Go check it out.
It's on our Instagram
results.
feed.
People are asking, why is she asleep right now? If we could lift that eye shield, guys. We had our upper bleph done before.
So you can see she had surgery. She had an upper eyelid surgery to remove the skin there, called an upper bleph. But now she decided, why not be asleep while we do that and get the acne scars improved? Why not? It's less painful.
Someone says, so do mine, guys. So guys, come in, send us a DM, full name, email, phone number. We'd love to have you in our office.
It's much quicker and much easier when you're asleep. I'm not saying you have to do that, but it is definitely something a lot of my patients do when they have surgery. We frequently do lasers at the same time as surgery. Can you guys move this up? The band.
People want to know if this is the active FX CO2.
This is luminous, yep. And we're just doing a pretty good fractional treatment. Her skin tone makes it so that we have to be a little more cautious.
Pre and post treat, guys.
Exactly. Let's lift up the hair. Remember, hair won't get damaged. It's just going to fry and take time to grow back. Okay. Going around. Okay. So now that half is done. You guys can see, take a look. All the little scabs there. We're going to move the tube. We're going to turn her over. Forehead is done. The reason it's bloody is we have to move the tube. The reason it's done is it's bloody is because we did the microneedling radio frequency. Can you guys hold this up? Okay.
How many days of downtime do we estimate she's going to have?
5 to 7, and a couple weeks afterwards of pink. Some people will get a little hyperpigmentation at days 18 to 21. We'll then treat with a peel at that time point. But if you have to have patience when you do a CO2, you have to be willing to look bad for a few months. It takes a while to see the results, and it also takes a while. The initial healing is a week, but it takes a while afterwards to see everything, even up to 3 to 6 months for the results. So it's really important you're ready and you're prepared. This is a once-a-year treatment for the average anti-aging, but for scars, you may need it a couple times in the year, so you have to be ready. Now, halo and other treatments, other CO2s can be less aggressive or more aggressive, so it depends on the downtime. But in a week, she can be wearing makeup. There's also some treatments you guys can do, like pico laser and laser genesis, that we can do after to make it, to speed up the redness and speed up the brown from going away. It's all about just communication.
Can you be put to sleep for this even if you are not doing plastic surgery?
Of course.
Yes, guys, we offer that as well.
Why
Make
not?
sure you send us a DM with your full name, email, and phone number.
Yeah, if you don't want to have pain, why not? There's different ways to go to sleep. We could do it different ways. But it's really fast, the CO2 resurfacing when you're asleep. I mean, there's minimal pain.
You go very quick.
So we're able to get through it quickly. Let me see over here. Just making sure every angle is done, but we don't hit the suture. So now we're going to do her nose. Make sure around the mouth is good. Move the tube to the right. What are they saying, Jordan?
Lots of people on here. Can you put CO2 on the earlobe and neck?
Yeah, you can. It's a little more dangerous. Typically, those areas do better with non-ablative lasers or halo. So you'd have to consult with us. We can do peels there as well. We can do that virtually too. So tell them how to make a virtual consult.
Guys, virtual consults. Guys, send us a DM, full name, email, phone number. That goes for all chemical peels as well. Skincare consults. We can have someone hop on a FaceTime with you and make sure you apply it correctly and you're healing correctly, guys. We follow up with you and we make sure you heal right, have the right pre and post treat.
Exactly.
You have the people hitting on you now?
What? What'd you say?
People hitting on me now.
Ooh.
They're saying, follow me, baby. We have saying, do it.
Go ahead and DM us.
Guys, send us a DM.
Send us your personal Instagram. All right. So that's really it, you guys. We did our triple pass microneedling radio frequency on her cheek. Finished with CO2, and now we're going to watch her heal. Everything did great. So that's our acne scar combination for today. Perfect.